The Friends Women's Association, FWA, is a grassroots organization founded by and for Burundian women to address the unique needs of women in conflict and post-conflict environment. It began in 2002 by a group of women who wanted to work together to improve each other's lives, and in particular, address the problems of poverty, HIV/AIDS, sexual violence, and post-genocide trauma in their communities.
Friends Women's Association was started with a group of women in 2002 after attending a workshop on trauma and HIV/AIDS in Bujumbura. And those women from the Evangelical Friends Church of Burundi decided to start an organization, Friends Women's Association, and their mission was to provide a comprehensive community-based health care of women and their families, to promote the women's leadership and autonomy, and to strengthen peace and solidarity in Kamenge and in other communities of Burundi.
Today, Friends Women's Associations work at a grassroots level to provide comprehensive health care to women and their families, to promote women's autonomy and leadership, and to strengthen peace and social solidarity in Kamenge and other communities in Burundi.
Boje mukumenya ikigufwa naje nizanye narangiwe n'umuntu kubera ingorane nari mfise zo gusubira hasi nipimisha ibiro nsubira hasi ngwaragurika hama ndagenda sinzandu ngiye kwa muganga basanga ngo ndagwaye ndivyamfashemwo neza ndiyumva yuko merewe nabi ndigumya ari ku mutima ukaguma umeze nabi hama ndafatwa na tension ndagenda kwa muganga kwivuza ku mahera bamfata tension koko barampa imiti ariko ntacyo yamaze niho umuntu umwe yambwiye ati urazi n'amakuru atego ati hano hepfo nyene aha nyene mu Kamenge ngo hepfo handu hamwe ngo genda uku nuku nte ngo hajya ngo barapima uko nyene ko yambariye ariko jene yarazi ko je ngwana amaze kugwara uragenda wipimisha urabe niko naje rero naje nizanye ego barampima basanga nivyo ndagwaye nkuko hari abari babivuze ego badufata neza baraduha imiti naje ngampima ibiro 35 ubu mpima 45.
To achieve this mission, FWA operates a health clinic in Kamenge, a suburb of Bujumbura, where it offers free or low-cost medical examinations and treatment to women and their families. Its services include primary care, preventive care, laboratory testing, HIV testing, and counseling and psychological counseling.
Bugambere na mbere bakuremesha ubwira kabiri bakakwereka yuko bagukunda kandi uri umuntu n'ivy'imiti byose bumva baraduha.
When Friends Women's Association started, the target group was those people living with HIV, especially women and their families. But when, after Friends Women's Association has already started, we were able to realize that we cannot fight against HIV/AIDS without contributing to family planning. That is why we have already started the family planning service. We have also included the program of fighting against sexual violence. When we started to fight against sexual violence, we started to help those victims of sexual violence, because we had realized that some people are affected. Some people have HIV/AIDS through sexual violence. So we started to conduct trauma healing workshops for those victims of sexual violence, And through those workshops of sexual violence, we realized that we have to fight against gender-based violence. That is why, starting with AIDS to fighting against HIV/AIDS, we realized that we have to include also family planning, and then to include also the gender-based violence, so that we can also address that issue here in Burundi.
In addition to medical services, FWA provides holistic health care to patients by incorporating those with demonstrated needs into its social assistance program, which include home visits and microfinance programs.
Ivyerekeye umugambi wa FWA turawushima cyane, turawushima bimwe bivuye ku mutima, kuko ndabona ko FWA yagiye gukiza abantu mu mitwe. Natwe ubwo abamama benshi bo muri aya makarite yacu ya Kamenge benshi turafise ingorane, bamwe nko muri twebwe no gusara twumva umenga twosara, ariko iki kigo FWA cyaradutabaye cyane. Araje mu makarite barondera abakenyezi badushira hamwe, mukuri baratwigisha ivyerekeye umugambi, ivyerekeye inyigisho zihahamuka. Ukuri izo nyigisho zaradufashije cyane, nkuko zaje kudukoropa mu mitwe, ko bamwe wamenga wo kwiruka n'abantu kabata, ariko ubu turatekanye mu mitwe, imitima yaragiye hamwe, mukuri byaratugiriye akamaro. Kindi naco nuko bace batwitaho, badushira hamwe, aratubwira ati nimuje hamwe abakenyezi nka 10, 15, 20 murondera umugambi cyangwa nimba mufise imigambi tubuhirireko. Ukuri twe twari dufise ivyo dukora, twaradandaza nk'ibintu by'imiceri, tuje ngaba twigishije izo nyigisho, nukuri baradufashe mu mugongo, baraduhongereza ko dufaranga duke, n'ubu turabandanya dukora, turadandaza.
To respond to our mission, our Friends Women's Association has already started a clinic, which is called the Nhaseka Clinic. It is based here in Kamenge, and as you see, you can see the buildings of the clinic, and this clinic includes different services. We have the nurse consultation, the medical consultation, we have a pharmacy, we have a laboratory room, we have a room for counseling. We have different services here so that we can respond to our mission effectively, because you know that we are fighting against HIV, you cannot be effective if you don't have a clinic. So it was in that context that we decided to start this clinic so that we can respond very well to our mission.
Finally, Friends Women Association ran community trauma healing and reconciliation workshop in the communities of Kamenge, Rutegama, Gitega, and Mutaho.
Through our beneficiaries here in Kamenge who were traumatized, who were victims of trauma, through listening to them, we are able to realize that gender-based violence is also present in our churches. So that is why we decided to intervene, to go so that we can address the root cause of gender-based violence, because we have realized that in our churches, even church leaders can also be also actors, can be the causes of gender-based violence. That is why we decided to go there.
Egome tutararonka izi nyigisho, hari ukuntu abantu benshi b'abakenyezi twikengera, tukabona yuko umenga ntaco twoshobora gushikako nk'iterambere mu ngo cyangwa mu gihugu. Mugabo tumaze kubona yuko abantu mu budasa bwabo bashobora gukora igikorwa kigatera kije imbere, natwe byaradufashije, bituma dushobora gufasha n'abandi. Nk'akarero nka jewe maze kuronka izi nyigisho, narabonye yuko ishyirahamwe FWA rifise uruhara rudasanzwe mu kukomeza ingo n'imiryango, kuko usanga hari abantu benshi bibaza ngo umugabo atahari ntacokogwa. Mugabo dusanga umugabo yoba hari, umukenyezi akaba hari, bahuriza ku mugambi umwe bawumvikanye ko bishobora kugenda neza.
By'ukuri kuba twarakoranye kandi twarabaye umwe mu bigisha bashikirije izo nyigisho zateguwe n'ishyirahamwe FUA. Ikintu gikuru novuga ciwe zaranyubatse ukamukora. Byanyubatse gute? Kenshi integuro bateguye integuro imeze neza kuko yari yerekana ihohoterwa rishingiye gitsina. Kenshi rero naje ubwa mbere wamenga nazazanirwa numvise ihohoterwa rishingiye ku gitsina, numva kumenga ihohoterwa rishingiye gitsina gore gusa. Mugabo uko nagiye nigishijwe nuko nagiye nanje kuvyigisha abandi nkumva ivyumviro kuva mu bandi byatumye ntahura cyane icyari cyo ihohoterwa. Cyasanga rero uwo mugambi wa FUA bawonse imondo bafashe kuwigisha abane igihugu, sanga ni ikintu gikomeye cyane cyotuma imiryango n'ingo n'abana bakiri bato ugwaruka bokura bazi icyari cyo ihohotera ko idashikira abakobwa gusa cyangwa sinabore gusa cyo gushikira n'igitsina gabo.
Les choses qui m'ont marqué, c'est que les femmes aussi essaient de comprendre cette réalité. Parce qu'en général, à l'intérieur du pays, les femmes ont continué de s'abaisser, de s'abaisser, de s'abaisser, en même temps que les hommes les baissent. Réellement, ces femmes étaient au niveau très bas, ils étaient sur le ras du sol, si je peux le dire. Maintenant, elles commencent à se relever, elles commencent à demander que leurs droits soient respectés. Je trouve que réellement, l'impact que FUA a joué est très important. Merci.
By'ukuri zirya nyigisho mwaduhaye ziradufashije cyane kuko hari ingo nyinshi bari bubatse nabi, bama bararyana bakama baratukana, mugabo twamaze kubatumira muri zirya nyigisho hanyuma bakazumviriza ubu n'amahoro bubatse neza.
Okay, we have also realized that young people are also victims of sexual violence, because through our workshop we had younger ladies with 16 years, 17, 18 years who were here as victims of sexual violence with some small babies. That is why we decided to also to find a strategy to help those young people, and in order to reach them, I have told you that we have different people who are making our stuff here. We have a young lady who is helping us to reach those young people. Yeah.
Turasensibiliza abajene benshi turabasanga muri quartier, tukagenda tukabahanura, no ngaha baraza baje gutora amakondomu, tukabaha karibu, tukababaza ibyo barondera, bakatubwira, tukabahanura ko bo kwihangana, abatashoboye kwihangana kubera ingwara ni nyinshi bagakoresha kondomu, bakaza no kwipimisha kubera bamenye ko ngene bameze. Tukasubira kandi tukabahanura byiza bibakundiye, bogira nk'umu bakagira umukopine umwe cyangwa bakagira umukope umwe, ibintu by'uko.
Je crois que maintenant, donc, avec l'avancée de la médecine, les gens commencent à comprendre que le VIH-Sida est une maladie comme tant d'autres. Même dans les politiques du ministère de la Santé, on commence à intégrer le VIH dans les autres maladies. Comme quelqu'un qui œuvre dans le VIH depuis longtemps, je vois quand même qu'il y a un changement. Les gens commencent à comprendre que le VIH est une maladie, que si les gens sont bien suivis, si les gens sont en train de prendre les médicaments, ils peuvent avoir une qualité de vie qui est meilleure.
We have a vision because we want to go to make a progress. We are thinking of, because I have told you that we have 2 plots of land. This one is already built, but you have another one which is not yet built. So we are planning if we can have enough funds to build the other one, so that we can include the services that are not available today. We are also planning to continue to build the partnership with other organizations, local and international. For instance, so that we can, our curing HIV positive people, so that the program can last for long. We are in a process to have partnership with the National Council against HIV, AIDS. So we are planning to build this one, many partnerships with other organizations which are intervening in the same domain as we are. Okay, thank you so much. The community, I can tell the community here in Kamenge, most of them are already aware of Friends Women's Association, but for now I can also tell them that we are here. Friends Women's Association is already here, and we are ready to help them. If they need family planning, they are welcome. If they need counseling, they are welcome. If they have trauma healing, we are here to help them. If they have been traumatized, we are here to help them so that they can be healed from their trauma. If there are people who are still believing that HIV/AIDS is a taboo, we are here. We are ready to help them and to create a safe place where they can share about their problems and help them according to their needs. Thank you.